I want to start the program off today talking about what I consider to be one of, if not the most underappreciated of all food nutrients, the substance that we generically call fiber. Neither vitamin nor mineral, nonetheless, fiber can be thought of as critical for good health, if not absolutely essential. Well, not one of the mighty 90 essential nutrients, but certainly fiber is absolutely vital to good health. While most of us know that fiber can help keep us regular, what is less well known is that fiber is important for the liver, it's important for the intestine, it's important for the bacteria that live in the gut, it's important for heart health. The bacteria that live in the gut can actually digest fiber and release numerous energy compounds that can help fuel biochemistry and prevent disease and stimulate digestion, suppress the appetite, improve brain health, cognitive functioning, mood, memory, as well as learning. And as it turns out, there are some forms of fiber that can support the immune system, that can reduce inflammation and even fight cancer. And one of these interesting anti-cancer fibers, immune-boosting fibers, is something called beta-glucan, which you'll find in a couple really neat longevity products, the Restart Your Life products, RYL 500 and the RVB 300, both of which are beta-glucan. RYL 500 has a little vitamin C and resveratrol in there. You can think of beta-glucan as a form of fiber, a form of soluble fiber because it dissolves in water. And in general, soluble fibers act to mop up excess blood sugar and excess blood fats. You can use soluble fiber to help lower blood cholesterol, and all of this makes soluble fiber important for heart health, for blood circulation, as well as for slowing down the movement of food through the digestive tract, thereby allowing the body to access vitamins and minerals more effectively. Soluble fiber can be helpful if you're dealing with bowel problems. Soluble fiber is found in fruits and veggies and grains. It forms the basis of what's called the BRAT diet, the BRAT diet: bananas, rice, applesauce, and toast. Some of you may have heard of this. It's used to treat babies when they have runny stools or diarrhea. The BRAT diet is a soluble fiber diet. But bananas, rice, applesauce, and toast are all rich sources of soluble fiber. For the most part, fiber, whether it's soluble or insoluble, is pretty bland and boring stuff. It's not digestible. It's not very reactive. And when it's dissolved in water, it is actually prized for its ability to thicken gels in the cosmetics business, and also in the food business. It thickens soups and thickens shampoos and soaps and cleansers and various skincare products, lotions and creams, etc. And because it's inert, cosmetic chemists and food chemists like it because it'll thicken their products without causing any kind of chemical reactions. An exception to this ordinarily non-reactive, inert nature of soluble fiber is the fascinating molecule beta-glucan, which is one of my all-time favorite sources of fiber, and an exception to the ordinarily non-active or inactive nature of most fiber. Beta-glucan is found everywhere in the natural world. It's found in all grains. It's found in yeast and fungus. Bacteria make beta-glucan. Unlike other forms of fiber, beta-glucan doesn't really react, unlike other forms of fiber, beta-glucan does react. It reacts with cells, particularly the cells of the immune system, particularly with a special cell called a macrophage. These macrophages, that means big eaters, macrophage, they're the Pac-Man cells of our immune system. Just like if you ever play Pac-Man, you see the little Pac-Man cartoon character munching down on the bad guys. These macrophages pretty much do the same thing. They munch down on the bad guys, whether the bad guys are bacteria or whether the bad guys are a splinter that you may have gotten inside your system, or whether the bad guys are cancer cells. Beta-glucan turns on the eating capability of these Pac-Man-like macrophages. Technically speaking, beta-glucan is a long strand of sugar molecules, glucose molecules specifically. Little pieces of glucose, which we also call blood sugar, get chunked together or pieced together to form this long string of fiber that we call a glucan. And it turns the sugar or the glucose from a bad guy, from a source of quick and explosive energy, into a non-energetic form that the body can use to stimulate the immune system and among other functions. It can help lower blood fats, as we say, lower cholesterol, and help fill you up and stabilize your intestine if you're dealing with diarrhea or runny stools. Perhaps the most dramatic and well-known property of beta-glucan involves its anti-cancer properties. It's thought that the medicinal properties that have been attributed to mushrooms for centuries are at least partially due to the fact that mushrooms are one of nature's best sources of beta-glucan. In Asia, in China and Japan, beta-glucan and mushrooms, the mushrooms that you get beta-glucan from, are used as a mainstream cancer treatment. According to Dr. Russell Blaylock, who's done a lot of research on this, beta-glucan is one of the most powerful stimulators of what are called natural killer cells. Natural killer cells are a class of cells that have anti-cancer properties and have been shown to control the growth of tumors as well as to prevent metastases. So you can use beta-glucan not just to prevent cancer, but if you already have it, beta-glucan may be helpful for helping slow down metastases or the spreading of cancer. And beta-glucan is not just for the inside of our bodies. You can use beta-glucan topically. You can put it right on top of your skin and it has benefits for protecting you from the sun. I've been using it in my skincare products now for many years. It's anti-aging, it stimulates the production of connective tissue, and it is wound healing as well. Now, if you're interested in beta-glucan, and you should be, after all that good stuff that we just talked about, you can get your beta-glucan from the RYL products, the Restart Your Life products, RVB and RYL products, RYL 500 and RVB 300 products. Both have beta-glucan, as well as vitamin C and resveratrol in the RYL products. RYL product. I'm Pharmacist Ben. You're listening to the Dead Doctors Don't Lie program. We'll take a break. I'll be sitting in for the next 45 minutes or so, as I always do on the Dead Doctors Don't Lie radio program, with my good friend and colleague, Douglas Winfrey. What's up, Doug? How you doing today, man?
Well, good and great to have you back on the show, as I've got a Fox News story here headlined, "Stress May Cancel Out Benefits of a Healthy Diet." According to a study, they say stressful events may cancel out the benefits of eating healthy fats. And this is a study from Ohio State Wexner Medical Center. They say knowing that both diet and stress can alter inflammation in the body, they sought to understand the relationship between stress, diet, and inflammatory markers measurable in the bloodstream. Chronic inflammation is linked to health problems like heart disease, diabetes, and rheumatoid arthritis. Researchers studied 38 breast cancer survivors and 20 other women, all who visited Ohio State on 2 different days and ate one of 2 meals while there. The researchers stemmed from a study looking at high-fat diets and depression in cancer survivors. One meal was a breakfast of biscuits and gravy. Oh, that sounds good. Made mostly with saturated fats, even better. And they say other meal was nearly identical, but primarily with monounsaturated sunflower oil. Women were all around the age of 53. And they took the daily inventory stressful events questionnaire to determine if they were under stress. And researchers asked them about previous days' experiences. A stressful event did not include minor irritants, but it did include something like having to clean up paint that a child spilled on the floor, struggling to help a parent with dementia who's resisting help. According to the lead author, Jan Keikolt-Glaser, a professor of psychiatry and psychology, said, quote, "They're not life-shattering events, but they're not of a hangnail nature either." Said the news release, in a news release, they said that during the study period, the women's blood was drawn multiple times, and researchers looked at 2 markers of inflammation and 2 markers that predict a greater likelihood of plaque forming in the arteries. Following the saturated fat meal, all 4 unhealthy markers were higher than after the sunflower oil meal. However, when women were reported to be under stress the previous day, there was no difference between the markers at all. So they're finding that they say researchers believe that the study is the first to show that stress has the potential to cancel out benefits of choosing healthier fats, but they noted that the inflammation builds up over time to contribute to disease.
You know what else, Doug? It's not just the good stuff, the good fats. It's all foods. When you're eating under stress, your body will be less efficient at maximizing utilization of nutrients, as well as just digesting your food, which is why you don't want to eat when you're under stress. You don't want to eat fast food. You don't want to eat when you're not paying attention to food. And it's also why one of the best ways to, if you're dealing with, you want to lose weight and you're dealing with food addiction or you're taking in too many calories, you'll find that you eat less food when you eat in a relaxed state. Your body is much better nutriated and gets much more value out of the food and the calories that you ingest when you're eating in a calm state. That's one of the reasons why deep breathing techniques can facilitate digestion. You know, one of the things that happens when we eat, one of the things that are required for appropriate digestion is oxygen. You can't burn the food. You can't break the food down. You can't digest your food appropriately if you don't have enough oxygen present. And slow, deep breathing not only will facilitate digestion because it relaxes you, It will facilitate digestion because it can help you release nutrients out of your food. Just another reason to make sure that you're operating in a relaxed state as much as possible, especially if you are eating and trying to absorb nutrients and digest foods. All right, we'll take a quick break and come back with more good health information and you and your phone calls as well on the Dead Doctors Don't Lie program. From the Journal of Alzheimer's Disease, this is dated September 13th, online advice for preventing Alzheimer's disease often problematic, according to research. This is from Canada, quote, Julie Robillard, assistant professor of neurology at UBC, which is the University of British Columbia. The quality of online information, quote, the quality of online information about preventing Alzheimer's disease ranges. Quote, the few websites offering high-quality information can be hard to distinguish from the many low-quality websites offering information that can be potentially harmful, unquote. Now, I got to tell you, Alzheimer's disease is something that I'm personally addressing with my dad. He does, well, technically speaking, Alzheimer's disease is early onset dementia. If you get dementia as you get older, that's not necessarily Alzheimer's disease. That is just dementia that's associated with old age. But the fact of the matter is whether the dementia is associated with aging or the dementia is early onset as an Alzheimer's disease, and my dad has the aging kind, it doesn't really matter. The real cause of Alzheimer's disease is the same cause as any disease. Alzheimer's disease is arthritis of the brain. It's osteoporosis of the brain. It is any disease that's chronic and long-term and degenerative of the brain. It is just degeneration of the brain. It's not a special disease. There's nothing special about Alzheimer's. If the same kind of degradation occurred in the lungs, you would call it fibrosis. If it occurred in the joints, you would call it arthritis. If it occurred a couple of millimeters to the back of the brain, you would call it Parkinson's disease. And this is a really important point when it comes to addressing health challenges. It doesn't matter what the diagnosis is in terms of reversal, and this is with long-term progressive chronic degenerative diseases. The diagnosis is not relevant from a reversal perspective. What's important is understanding that our chronic and long-term progressive degenerative diseases, which account for 80% of our health challenges and health costs in this country, they're all the result of bodily breakdown, period, end of story. And where they are occurring is not anywhere near as important as the fact that they are occurring when it comes to reversal. So you say, well, what is it that causes the degeneration? What is it that causes the progressive long-term breakdown of the body? Well, no matter where it's occurring in the body, there's only three things that cause this progressive degeneration. Number one, toxicity, and I'm including sugar in that when I talk about toxicity, because sugar is a toxin after a certain amount which is necessary. The second issue is hypoxia or low blood oxygen. And the third issue is nutritional deficiency. Folks, that's it. From a physical perspective, whatever your chronic, long-term degenerative health challenge is, you got to make sure that you're breathing correctly and oxygenating. You got to make sure that you're eliminating toxicity, and that includes reducing your sugar intake. And you absolutely 100% have to make sure you're eating correctly and you're on a good nutritional supplement program that features the Mighty 90 essential nutrients. The word essential means just that. Essential. Essential nutrients are like oxygen, and without them, deficiency diseases cannot help but occur. And this is so important because we live in a world of medicine. We live in a world where we're medicated at every turn. And at the end of the day, it's good nutrition that is the best medicine. Who is first online, Doug?
All right, let's head to Columbus, Ohio. And Sonia, you're on with pharmacist Ben Fuchs.
Hey, Sonia.
Hey, how are you?
Doing good. What's going on in Columbus, Ohio today?
Oh, it's nice and sunny. It's supposed to
Is
be the
it?
first day of fall, but can't tell. But we're enjoying the sun.
Good for you. What's going on?
Yeah. Okay, my husband is on dialysis. He's been on for 8 years. Talked to Dr. Wallach about a year ago,
Okay.
and he suggested the Healthy Heart Pack and Celium and a few other things. But the only issue we're running into is with his T levels.
With his what levels?
PTH levels.
Parathyroid hormone? PTH levels?
Yeah, which they check his numbers. It's supposed to be like 600 or below, but they've been like 1,263. That's what it is right now. And they're telling him to stop taking the OsteoFX.
Are they telling him his calcium's too high or something?
Yeah, so we're wanting to know.
I can't tell you what. It's nonsense. It's silly. I can't tell you what to do with your doctors because he's under the care of his doctors, but it's silly. He needs calcium. He needs nutrients. His body's not processing them correctly, that's for sure, but that's not an excuse to not use them. That's their opinion, and you're going to have to do what you want to do with that, and keep in mind he is being cared for by the doctor, so that's between you and your physician. My opinion is that's silly. Now, here's the thing. If he has chronic kidney disease, did you say he's a diabetic? He is a diabetic, I'm sure, whether he's been diagnosed as such or not. Here's what you need to do. The kidneys filter the blood. They're like a spaghetti strainer for the blood, okay? That's their job. The reason why the kidneys break down and kidney disease is an epidemic, and it takes a lot for you to have to be on dialysis. I mean, you get 2 kidneys. That's how important your kidneys are. You get 2. You can make do with 1, and you can actually make do pretty reasonably until your kidneys lose maybe 80 or 85% of their functioning. So it takes a lot for the kidneys to get damaged. That means a lot of dirty blood. So what you want to do is you want to start to clean the blood. The most obvious and the most problematic of the blood toxins is sugar, and this is why diabetes and kidney disease are linked. So keeping your sugar intake down is an absolute must. And of course, when I say sugar, I'm talking bread and pasta and potatoes and rice and sweet potatoes and cereal and fruit juices and fruits and anything that breaks down quickly into sugar. That's job number 1 if you have a kidney problem. Now, you also want to make sure that you're using the sweeties and nutrients that help the body process sugar, including the Ultimate Niacin, one of my all-time favorite longevity products. Now, it just came out maybe a year and a half ago, but niacin has been used in the world of pharmacy as a medicine since I became a pharmacist, but even before then. I remember using niacin as a go-to nutrient for helping lower blood fats and lower cholesterol, and as it turns out, niacin is a very, very important nutrient for helping lower blood sugar. So I would be throwing in the sweeties, I'd be throwing in the Ultimate Niacin, I'd also be adding in this Fucoid Z, which can also have some blood thinning, blood purifying, and anti-sugar effects. Now, in addition to cleaning out the blood by eliminating or reducing sugar and improving the body's ability to handle sugar, you also want to make sure that if there's any kind of foods that your husband is having a problem with, food intolerances, digestive issues associated with foods, those are foods that that you eliminate. And last but not least, if he has any digestive health issues, you want to consider something called leaky gut syndrome, which is where toxins get into the blood and thicken the blood and create an inflammatory reaction in the blood that can also mess up kidney problems. All of these are much more important strategies for you, for your husband, and for your doctors to be considering than to tell him to take off, lay off of his calcium supplements. Thanks for your call. Appreciate it. Sonia from Columbus, Ohio. Time to take a commercial break on the Dead Doctors Don't Lie program. If you're on hold, hang tight. We'll get to you when we come back from our break. I am Pharmacist Ben, along with Doug Winfrey, sitting in for Dr. Wallach today. For Sonia from Columbus, Ohio, who just called us, one more thing you might want to add to our kidney protocol, including the sweeties and the Fucoid Z and the Ultimate Niacin and the Brain and Heart Pack. You might want to try our Ultimate Daily Classic, which will get you all the basic nutrients, as well as making sure you're getting some good old sunshine. Very important for vitamin D and very important for calcium metabolism as well. Thanks for your call, Sonia from Columbus. Appreciate it. Who's next in line, Doug?
Let's head to California. And Debbie, you're on with pharmacist Ben Fuchs.
Hey, Debbie.
Hi, how you doing, Ben?
Doing good.
I'm
What's
really
going
glad
on?
You guys are on helping people today. My question is, I guess it's like getting the tumors from inside outside. Like Steve McQueen, I heard went to Mexico when he was alive, and some doctor brought the tumors outside on his back. And then I think he freaked out when he came back and had them taken off his back, and that's how he died. I'm not sure, but I heard that. And I want to know, how do you get the tumors from inside to come out?
Never heard of that.
Because
my
animals have had tumors inside, and they die from the tumors. and I don't know how to.
I don't think that doesn't. I can't figure out the biochemistry of that. That doesn't make sense to me, Debbie. I'd have to look into that. I've never heard anything like that. They take tumors from the outside and put them outside the body. Is what you're saying?
Yeah, that's what he did.
I'd have to look in. You know what? I'm going to have to take a pass on that, my dear. I don't know the answer to that, but I can tell you that for cancer, you might want to consider beta-glucan. We talked about that at the beginning of the program. You might want to listen to the archives again. Beta-glucan is absolutely spectacular stuff, and there's a lot of wonderful literature, anti-tumor, anti-cancer literature about beta-glucan. Of course, Youngevity's got a couple. Restart Your Life's got a couple good beta-glucan products. Youngevity has them via Restart Your Life, the RYL 500 or RYL 500 and RVB 300, if I'm not mixing those two up. They're both beta-glucan products. Thanks for your call, Debbie. I'm not sure how to answer that question, though. All right, who's next in line, Doug?
Let's head to Georgia. And Cheryl, you're on with pharmacist Ben Fuchs.
Hey, Cheryl.
Hey, how are you, Ben? I got one quick question.
Okay.
All right. Reversing the leg issues that you get from statin drugs, can you reverse that?
Like crampiness? Like what be specific? Muscle crampy?
No, it's like your muscles deteriorate is one of the side effects.
Yeah, that's exactly right. Cholesterol is cholesterol is important for a lot of things, and in a very good case could be made for cholesterol being the most valuable player of the body. You know how every year in baseball and basketball and football they pick the most valuable player? Well, a very good case could be made for cholesterol being the most valuable molecule in the body. MVM, the most valuable molecule. And to suppress its production artificially and pharmacologically, I cannot possibly begin to express the biochemical stupidity of that logic. And anybody who ever prescribes a statin drug has to go back to Biochemistry 101 to understand what cholesterol is. Now, patients can be forgiven because we're not experts. Patients are not supposed to be experts in health, but healthcare professionals who dispense statin drugs really do not understand the fundamental value and importance of cholesterol. Aside from being important for brain health and for the health of the immune system, cholesterol is important for the production of all the steroid hormones in the body, but it's also important for the manufacturing of the outside part of the cell, the so-called cell membrane, and that includes muscle cell membranes. Without cholesterol production, without effective cholesterol production, you are likely to have muscle problems of all kinds. And ironically, of course, the heart is largely made up of muscle tissue. That alone tells you the stupidity of blocking cholesterol production when you figure, well, gosh, my heart is made up of muscle tissue and the muscles need cholesterol. Does that make sense to suppress cholesterol production when my heart's a muscle, essentially? No, it doesn't make sense. As far as leg muscle problems go, if you're going to poison yourself with a statin drug, well, yeah, there's nutritional things you could do, but it's like having a hole in your boat and trying to bail water. Yeah, you might be able to bail water, but as long as you got that hole in the boat, you're not going to go anywhere. You may not sink, but you're not going to be able to get very far. So if you're on a statin drug, yes, it becomes extra important to use essential fatty acids, the ultimate EFAs, absolutely 100%. You probably should be using magnesium. You should probably be using vitamin E and all the fatty vitamins, really. Of course, the Healthy Start Pack, that goes without saying. I would also use the ultimate niacin. In fact, as I was talking about with Sonia earlier, niacin is almost, if not as potent as statin drugs for lowering cholesterol with no toxicity and with no side effects. You guys, if you're on a statin drug, get on the ultimate niacin and gradually wean yourself off the statin drug. Tell your doctor, hey, listen, I want to use niacin instead of my statin drugs. You can watch me, you can monitor me, but I'm going to get on this ultimate niacin and I want to be weaned off the statin drug. Not only will you not have to deal with the side effects associated with the statin drug, but because niacin helps your skin, helps you give you healthy skin, it helps your brain work, it helps your digestive system work. You'll be getting all of these multiple benefits from the niacin in addition to lowering your blood cholesterol without having to deal with statin drugs. Also, if you want to lower cholesterol naturally, you might want to consider beta-glucan as well. We talked about that one at the beginning of the program. Soluble fiber in general has a cholesterol-lowering effect. You'll get soluble fiber in fruits and vegetables, but if you want to get a little extra soluble fiber and you want the immune-boosting properties of beta-glucan and the anti-aging properties of beta-glucan, use your Restart Your Life beta-glucan products that you'll find. You can get off the Youngevity website, or you can find out about from your Youngevity rep. Thanks so much for your call. Appreciate it. And let's see if we get one more call in before we go to break, Doug.
All right, let's head to Michigan. And Dave, you're on with pharmacist Ben Fuchs.
Yo, Dave, what's up?
Hey, Ben, how you doing?
I'm doing good. How can we help you? Dave in Michigan. Where in Michigan are you, first of all?
I'm in the thumb of Michigan.
Oh, I know you.
You know me.
Yeah, I know you. Dave in the
you
thumb. Didn't I talk to you a couple days ago?
You talked to me this morning.
Oh, it was this morning on the air?
Yeah. Well, no,
Okay.
it was when you were in the airport having your eggs for breakfast.
Oh, no, that was yesterday.
Right.
Okay, gotcha. All right, what's going on, Dave in the thumb?
My buddy called me from Oregon, 49-year-old athlete, 215 pounds, 6 foot tall.
Okay.
Been having some chest pain issues, and he went in and had an angiogram, and they said, "Oh my God, this blockage is in a spot that we can't fix with a stent. If you don't have a double bypass within a week, you're going to die."
I would be very, very careful and skeptical, and I just would not take one doctor's opinion. If they want to cut open your chest and take out your heart and start monkeying around with the vessels, I sure wouldn't just take one doctor's opinion on it. In fact, I would avoid it at all costs. I'm not telling him what to do. I'm not telling anybody what to do. But if it was me, I would be avoiding it at all costs. Number one, let me give you a couple ideas here. First of all, you got to take care of the diet. The blood becomes dirty because of food, primarily, and that includes sugar. So taking care of the diet becomes extra important. I'd be going ketogenic. I don't know if you know, but you've probably heard me talking about the ketogenic diet. But for the listeners, it's a high-fat, low-carbohydrate diet, very, very heart-friendly. How do you like that, by the way? High-fat is heart-friendly, despite what you may have heard from your local medical professional. High-fat is heart-friendly in a context of low-carbohydrate and in a context of calorie restriction. So I'd be eating a lot less food, and I would be going ketogenic, using more fat and almost zero tolerance for carbohydrates. The true ketogenic diet is about 10% of your calories coming from carbs, which is something like 3 or 4 tablespoons of carbohydrates a day, and then a moderate amount of protein, maybe twice as much protein as carbs. So say 6 or 7 tablespoons of protein a day, and the rest of your calories coming from fat. Also, there are incredibly important heart-friendly nutrients. Vitamin C is the ultimate heart nutrient. You'll get that in the Beyond Tangy Tangerine. And vitamin C also has a property called chelation, or it exhibits a property called chelation, which is magnetically attracting dirt out of the blood. If you have clogged arteries, well, basically what that's saying is your blood is really dirty, and by magnetically attracting dirt or chelating the dirt out of the blood, you can help clear out blockages, and you can help clear out the arteries, and you can help clean the blood. So you get that in the Beyond Tangy Tangerine. Selenium is also a really important chelating agent, very important for the heart. I'd be using the selenium as well. Same with the Fucoid Z, very important blood cleaner, if you will. The Fucoid Z contains something called fucoidin, which is an absolutely fascinating sugar-like material. Beta-glucan may help clean out the blood as well. And then, of course, the B vitamins, which you'll find in the Beyond Tangy Tangerine, are super-duper heart-friendly. Hang tight, Dave, because there's a couple more things I want to tell you. When we come back from our break, we'll do that. I'm Pharmacist Ben. Okay, we are back on the Dead Doctors Don't Lie program. Dave in the thumb. A couple more things for the heart. Essential fatty acids, the ultimate EFAs and the ultimate EFA plus, are really important. I like the EFA plus a little bit better. Your OsteoFX is also important for the magnesium and the vitamin D. And vitamin E and coenzyme Q10 also play a very important role in heart health. Worst comes to worst, or even if you just want to add one more thing to the protocol for anybody dealing with heart blockages, think about chelation therapy. We talked a little bit about vitamin C and selenium as chelating the blood, cleaning out dirt out of the blood magnetically. That's what chelation is, or from an oral standpoint, but you can actually have chelation therapy done intravenously, where they'll put a chelating agent right in the blood to magnetically attract dirt out of the blood and help clean the blood out and unclog the arteries as well. Thanks so much for your call, Dave. Appreciate it. And who's next in line, Doug?
Let's head to Washington State. And Mary Lou, you're on with pharmacist Ben Fuchs.
Hey, Mary Lou.
Hi. Sure, I got on. Got a problem. I had a heart attack about a year ago, the same time last year. Now they've diagnosed me with chronic kidney disease.
Okay.
Found that up through my insurance company. Stage 3. I'm in a panic.
Well,
they told me no sugar, low carb, no supplements. And
I don't know why they told you that. Who told you no supplements? Your doctor?
Yes.
Okay, well, you're going to have to.
I'm really confused.
Yeah, you're going to have to. You're going to have to figure that out by yourself. I don't know why your doctor would say something that nonsensical, and unless I could talk to him, I'm never going to know, I suppose. One of these days, I'd like to have a conversation on the air with a doctor who says these silly things. In any case, here's the deal. We talked, and if you heard us talking a few moments ago, we talked about the link between the blood and the kidneys, and that is the heart and the kidneys as well. And this is a major, major point when it comes to taking care of kidney disease. You got dirty blood, my dear, and the fact that you had a heart attack is just compounding things, because with a weakened heart, the blood is not going to be circulating as effectively, and it's more likely to accumulate dirt. So what you got to do is you got to keep the blood clean. Everything we just talked about with my friend Dave and the thumb previously, it applies for you as well. Get on the Healthy Start Pack, number 1. Make sure you're using your Ultimate Selenium, number 2. Make sure you're using your Fucoid Z, number 3. As we talked about earlier in the program, the Ultimate Daily Classic is probably a good idea. Also, make sure you're getting enough vitamin D from the sun. You also get some vitamin D in the OsteoFX product as well. That's part of the Healthy Start Pack. If you want to do a couple more things, and it's advisable that you do, focus on digestive health. This is the number 1 reason why the blood becomes dirty. Kudos to your physician or whoever told you to keep your blood sugar down and to watch out for your sugar. That's extremely, extremely important. As we've said, sugar represents a toxin, and you got to keep your sugar down. That's where the ketogenic diet can benefit you. Ketogenic diet being a low-carb, high-fat diet. You might want to look into that as well. And then you might also want to consider using nutrients that help your body process sugar. Selenium is helpful. It's also helpful for the heart, and it's also helpful as a chelating agent. But it's part of the selenium is involved in insulin production, and it's part of the way that the body handles sugar. So using 400 to 600 micrograms of the Ultimate Selenium is probably a good idea. All the B complex is very important for the heart. I'm shocked that your doctor would tell you not to supplement, because he should know good and well that the B complex is important for helping protect the body against homocysteine, which is a toxic compound that's found in the blood. The B vitamins, particularly thiamine and niacin, are also very important for blood health, and that's found in the B complex are found in all living foods, eggs and dairy and vegetables and organ meats, living or formerly alive foods, I should say. And then, of course, electrolytes are very important. You get all of this in the Beyond Tangy Tangerine, as well as the Healthy Start Pack. In particular, potassium, calcium, and magnesium are 3 electrolytes that are very important for the heart. I'm not sure why your doctor would tell you something like that, but I suffice it to say I disagree. And I'm not just disagreeing because I'm disagreeing because I've been doing this for 30 years, and I cannot tell you the number of times I have seen health conditions reverse, or people get off their prescription drugs, or folks just feeling a lot better when they get on a nutritional supplement program. If you're in the bubble, check out the Youngevity products, and why not start a Youngevity business and make some money at the same time? All right, I'm Pharmacist Ben. Thanks for listening, friends. For Doug and for Doc Wallach and Michael Z and all the folks at the ZBS Radio Network, have yourselves a wonderful, beautiful, awesome, spectacular day. We'll talk to y'all later, folks. Bye for now.